Ayurveda for Cancer Therapy, a review. This is printed in the Journal of Ayurveda and Integrated Medical Sciences, May 2023. Abstract. Malignant cells multiply and divide uncontrollably in a variety of disorders known as cancer. These cells form tumors, which are cancerous growths. There are various treatments available for cancer. Still, Ayurveda plays a significant role. Ayurveda may be beneficial in the prevention, palliation, treatment, and support of cancer in a variety of ways. Ayurvedic medicine helps to raise living standards. It can be used in conjunction with chemotherapy or radiation therapy as an adjuvant or co-therapy. Ayurvedic treatment minimizes toxicities of chemotherapy and radiotherapy. In case of recurrence, Ayurvedic maintenance therapy will be helpful. Introduction. Cancer is one of the most devastating illnesses. Present significant health risks in both developed and developing countries. It's the second leading cause of death behind heart disease. Cancer starts almost anywhere in the body. Cancer is a category of diseases, and each of its own various neoplasms has a unique set of identifying traits and a unique course of development. In all human tissues, cancer has not yet been linked to a single cause or mechanism. Additionally, it's possible that changes in lifestyle over time have caused a change in the etiology, causes, and mechanisms of carcinogenesis. A neoplasm or tumors is a mass of tissue formed as a result of abnormal, excessive, uncoordinated, autonomous, and purposeless proliferation of cells, even after removal of stimulus for growth which caused it. Neoplasms may be benign, where they're slow growing and localized without causing much difficulty to the host, or malignant, when they multiply, proliferate rapidly, spread throughout the body, and may eventually cause death of the host. All tumors have two basic components: parenchyma, comprised by proliferating tumor cells, and supportive stoma, composed of fibrous connective tissue and blood vessels. The tumors are named with suffix "oma" to denote benign tumors. Malignant tumors of epithelial origin are called carcinomas, while malignant mesenchymal tumors are named sarcomas. For examples or combination of tumors are mixed tumors, teratoma, blastoma, hamartoma, and choristoma. Ayurvedic perspective. According to Charaka and Sushruta, cancer is an inflammatory or non-inflammatory swelling. It resembles with aruba or granthi. In Ayurveda, cancer is not seen as a separate illness or group of illnesses. Instead, all illness are the result of severe systemic dosha imbalances. Specific diseases like cancer are caused by interactions between aberrant doshas and weak dhatus. Although cancer is not specifically mentioned in Ayurvedic literature, symptoms associated with the granthi, glandular cyst, aruba tumor, or cancer group of disorders are closely comparable to the different forms of cancer or symptoms associated with cancer. Ayurveda, which bases its healing methods on organic compounds. The name Apache, Guma, Granthi, and Arbuda are examples of clinical systems that are similar to cancer and are mentioned in ancient Ayurvedic texts. Materials and methods. Materials have been compiled from classical textbooks of Ayurveda, modern science textbooks, published articles, research journals, and the internet. Pathogenesis. It's primarily based on doshic theory, specifically Vata, Pitta, and Kapha. According to doshic theory, cancer develops when there's an imbalance between doshas. Vata is the active dosha. It plays a role in the metastatic process. Pitta's, being tejas, increases metabolic activity of the cancerous cells, while Kapha, which is guru and bulky, is responsible for aberrant multiplication of the cells. Vata and other doshas associated with kapha getting aggravated and cause vitiation of the muscle tissue as induced muscular swelling almost anywhere in the body that is round, static, immovable, with mild pain, large in size, deeply rooted, expanding slowly, and not ripening, generating pus. Types of Arbuda according to doshas: Vata, Pitta, Kapha, Tridosha. Types according to dhatus: Raktu, blood; Mamsa, muscles; Metas, fat. The creation of Arbuda may be triggered or precipitated by irritability and trauma. The muscle that was struck by the fist or other object becomes vitiated and causes are immovable. Stone-like swelling in the site of the injury that is painless, unctuous, and the same color as the surrounding skin. This condition is known as Mamsa Bada and is incurable. Even among those that can be cured, the following types should be avoided: those that exude heavily, those that are located in critical organs or routes, and those that are immovable. Those who have knowledge of the Arbuda's tumors refer to that which develops, grows over an earlier one as Adya Buddha, and that which is either at the time or after some time is referred to as Dvira Buddha. All of these are uncurable due to the prevalence of kapha and metas, fat, the stability of the doshas, and those created the lump, hard mass. All Arbudas, malignant tumors by nature, do not create pus. Types according to prognosis: Sadhya, curable; Adsadhya, incurable. The normal history and physical examination include important information in every component. How chronic the sickness is may be determined by how long the symptoms last. The patient's past medical history may reveal underlying illnesses to the doctor, which may affect the selection of medication or the side effect of treatment. The social history may reveal occupational exposure to carcinogens or practices such as drinking or smoking that might have an effect on how the illness develops and is treated. Due to the family's history, potential hint at an underlying familiar cancer predisposition, the patient's siblings who are unaffected may need to begin getting surveillance or other preventative therapy. Management: surgery, radiotherapy, and chemotherapy remain the most effective method of treatment for cancer, which is the second biggest cause of death globally. Chemotherapy, radiation, and medications made from chemicals are some of the current treatments. Patients may experience significant stress and further health harm as a result of treatments like chemotherapy. The use of alternative therapies and treatments for cancer is therefore prioritized. Shaman Chikitsa. Traditional medicine methods have played a crucial part in addressing the world's healthcare requirements. Ashes of basma of gold, copper, mercury, lead, zinc, iron, diamond, and other minerals and metals are used in the formulation of Ayurvedic medicines and treatments. They act as catalysts and target specific. Ayurvedic remedies can help halt the progression of cancer, where chemotherapy, radiotherapy, and surgery are contraindicated by various reasons and patients have no other options. Some anti-cancer herbs: Cucuma longa, Ocimum sanctum, Tinospora cordifolia, Withania somnifera, Umbilica officinalis, Zingiber officinale, Oringe oleifera, Alsonia scalaris, Mystica fragrans, and Bonhivnia verge. Panchakarma and Rasayana rejuvenation. Detoxification of the body on a cellular level is helpful for eliminating aggravated doshas. Purifying therapies used in Panchakarma to enhance metabolic processes can completely break down a malignant tumor. The tumor is slowly absorbed by the body without the use of a surgical procedure and expelled out by the lymphatic system. We can dissolve tumors with the help of Ayurveda, but if it's badly necrotic or present on the body's exterior, then surgical intervention is required. Ayurvedic treatment is used to cure tumor if the tumor is internal. Ayurveda is recommended for conservative management for several months and then go for surgical procedure. Oil massages with therapeutic herbs and essential oils are beneficial for body and mind. Rasayana rejuvenation. Rasayana therapy increases the production of new cells and tissues in the body. Help in the repair and building of muscle tissue. It enhances ojas to increase immunity, nourishes cells in the body, as well as prevents and treats issues linked to cancer. Exposure to ionizing radiation throws the body's natural equilibrium off, alters tridosha that manifests as radiation sickness. Rasayana therapy is very helpful in such conditions. The herbs used in Rasayana treatment prevent damage caused by free radicals. They're antioxidant, anti-inflammatory, radioprotective, chemoprotective, helps in prevention of DNA damage in immunomodulatory. Rasayana, Javanaprasha, Brahma Rasayana, Ashwagandha Rasayana, Amrita Prasham, and Triphala Churna. Satwaja Chikitsa. Cancer also has significant effects on one's mental and emotional well-being. After a diagnosis and throughout therapy, it's natural to experience feelings of anxiety, depression, dread, or worry. In this situation, Sawache Chikitsa plays an important role in improving well-being, harmonize the body, mind, and soul, and it can increase vitality, reduce stress, blood pressure, and anxiety. It also maintains general health. Conclusion. Ayurveda supports internal healing, boosts immunity, promotes general health balance, and speeds up recovery. The key to curing cancer is early detection and improved screening. Classical approach of Panchakarma, Rasayana, Satwaja Chikitsa helps in relieving signs and symptoms as well as side effects of chemotherapy and radiotherapy. It also helps to increase the lifespan of the individual and improves the quality of life.